Welcome to the section of cardiology. This is Dr. Jaitly. In this section, I'll be talking to you about the causes of chest pain, which are several, and the ones that are not originating from the coronaries. In other words, angina and heart attack, which have been discussed in other video sections or presentations. I will not be alluding to that in this section, but nevertheless, the other causes of chest pain are as important, sometimes as serious also, and they originate from the chest wall. They've originated from the heart or from the neighboring structures around the heart. So let's take one by one, but first examine the schematics here on either side of my text. Looking at the outside of the heart appears the following way. You have four pulmonary veins on the top which are pouring blood into the left atrium. Now obviously they're bringing the oxygenated blood, so it's being shown by the red arrows. The aorta is the big hose that's coming out of the left ventricle, and that's supplying the oxygenated blood to the rest of the body, including the heart, obviously. And the two coronaries that run or branch off, they are the first set of branches rising from the root of the aorta. One is the right coronary, which supplies this portion of the heart, and the other is the left and divides into further tributaries and branches, and they are also supplying the other portions of the heart. And then we have two veins, big veins, which are pouring into the right atrium as they appear from the outside of the heart. One is the superior vena cava, bringing the blue or the deoxygenated blood, and this is inferior vena cava, bringing the deoxygenated blood from the lower half of the body. This is coming from the upper half of the body. Now let's examine this schematic where you're looking at the inside of the heart. The same heart, when you look at from inside, appears the following way. So you have inferior vena cava, superior vena cava, the four pulmonary veins like I showed you there. And we know the heart is four-chambered, so obviously the two atria on the top, the two ventricles at the bottom. The aorta, as it comes out, sends the oxygenated blood up to the brain and to the rest of the body after the left ventricle has squeezed all the oxygenated blood. The right ventricle is connected to the pulmonary artery, so sends the blood over to the lungs on either side situated from the heart for oxygenation purpose. So in a nutshell, that is how the circulation goes. Now, the causes of chest pain are numerous. So remember, the heart has, just like any other organ, has the nature has given us a nice capsule or a little covering around every organ, and that's called pericardium. The pericardium is the outside covering of the heart, and sometimes that could be inflamed. It's called pericarditis. So that could, any inflammation, remember, gives you chest pain. Like if you have an inflammation on your skin, dermatitis, say skin of your cells in the legs, etc. It's a very common area where infections in the legs occur. It's called cellulitis. Or you can have infection of your eye in the conjunctiva. It's called conjunctivitis. I'm sure you're familiar with these terms. So itis implies inflammation. So this is pericarditis. Okay, very simple. So inflammation of the pericardium will be called pericarditis. We know because we have a covering outside the heart, we also have a covering for the lungs. And the lungs are situated on either side of the heart, as you know, in the chest. So there are two lungs. So the one predominantly on the left side, because the heart is mostly on the left side, even though it's centrally situated within the chest, but the apex here is situated more towards the left side. So the left side, if that's inflamed, the pleura is inflamed. Pleura is the outside covering of the lung. If that's inflamed, it's called pleuritis. That'll give you chest pain. We'll define the characteristics of all these pains because one differs from the other in a different video presentation, but that's beyond the scope of this time. But I'm just enumerating the causes of chest pain, so this way we can then decide just by history, or at least lead us to believe where the pain is originating from based on what the patient defines. Mitral valve prolapse and aortic stenosis. Mitral valve prolapse is here. The mitral valve is situated here, and sometimes the valve can be very redundant. It's almost like a parachute type of texture, where when the left ventricle contracts, normally the valves will close as if like they're closing like a door. But in this setting where the mitral valve prolapses into the left atrium, it's almost like a sail of a ship or a flail type of texture. So in other words, bulges into the left atrium, and that can cause chest pain. Aortic stenosis, which is here, the aortic valve that's situated at the mouth of the aorta, and that's sometimes causes chest pain because of numerous reasons we'll talk about later, but predominantly the coronaries which are arising from the aorta or near the aortic valve, they could be affected. And of course, there is increased muscle mass of the left ventricle, which requires increased oxygen demand. So whenever there is a demand-supply ratio imbalance, aortic stenosis is a classic example where chest pains can occur as a result. Pulmonary vessels, these are the pulmonary vessels, pulmonary veins here, and then the pulmonary artery here. Obviously, when you have a lot of congestion going on because of the valvular problems or congestive heart failure, it's called pulmonary hypertension. And that'll give you a cause of chest pain to use it as a differential diagnosis. Aortic dissection, that's a very, very serious condition, and that deserves a special attention at a later time. But just remember, it's an emergency. Aortic aneurysm and aortitis, where the aorta is inflamed again, and aortic dissection implying that the walls are starting to dissect because of weakness within the aortic wall. And we will devote a full section at a later time, but obviously it's an emergency. Myocarditis, IHSS, or HOCM we call it. So these are the various causes originating from the myocardium. What is myocardium? Myocardium is the muscle, the heart muscle. The inner lining is called endocardium. The outside line we just identified was pericardium. So pericardium, myocardium, and endocardium, okay, which is the valve. So these are the three layers of the heart wall, or the muscle wall, if you will. Heart failure can also cause chest pain by again, an oxygen demand supply ratio imbalance that develops because of the congestion that starts to occur and failure to meet the needs of the oxygen by the heart as well as by the body. So one can have chest pain as a result from heart failure. Chest wall, now that's very important because the overlying chest wall or the breast tissue can be inflamed, and the overlying tissue, specifically the skin, the cartilage, the ribs, the breast tissue, they have been identified to be inflamed, and many times that could lead to one to have chest pains as a result. And there is a syndrome that goes by the name TZ syndrome, costochondritis, and that's quite common, and that's because of the inflammation of the junctions where the ribs meet the cartilage in front of your breastbone. So that is commonly inflamed. Invariably, it's we don't know the cause, but many times it's just a simple virus, and it requires analgesics, etc. And we'll talk about those at a later time. But just to know that these are the causes of chest pain that I've just enumerated, and so it's getting interesting as we move forwards. So keep in mind all these structures and all these pains originating from various structures as we talk about and identify them individually at a later time. Thank you for your attention, and looking forward to talk to you again. Bye.